So if you leave a piece of aluminum foil on your leftovers and, put it in the microwave.
You get a massive fireworks show.
Right, exactly. Now imagine that same reaction happening inside the human body. Welcome to the deep dive.
Yeah, today we are looking at a pretty wild but incredibly common medical question.
Can your IUD turn into an active heating element if you get a vaginal energy treatment?
I know it sounds like science fiction, but it is a very real scenario playing out in clinics everywhere.
I mean, we are putting devices inside the body to prevent pregnancy, and then we're beaming lasers and radio frequency waves into that exact same anatomical space.
And understanding the physics of that collision is an absolute requirement for your safety.
Okay, let's unpack this. Our mission today is to dig through a massive stack of medical clinic guidelines and FDA safety communications.
Along with expert clinical FAQs, yeah.
Yeah.
We need to understand the precise interaction between these overlapping technologies.
We're going to explore the mechanics of the energy treatments, the literal geography of the intrauterine device, and what this all means for your pelvic health.
Because if you are one of the millions of people who rely on an IUD, and you are considering any kind of vaginal rejuvenation or tightening procedure,
You are standing right at the intersection of two very different medical worlds.
to navigate that intersection safely, we first need to map out the baseline geography.
Right, before we analyze how thermal energy affects an IUD, we have to establish where the device actually lives.
And specifically, the function of those attached strings.
So the IUD itself, that little T-shaped piece of plastic or copper, sits high up inside the uterus.
But it has these thin threads attached to the base. Those strings extend down through the cervix and sit slightly protruding into the upper vaginal canal.
And those strings serve a highly specific medical function.
Exactly. They're the only way a healthcare provider or you as the patient can confirm the IUD is correctly positioned.
Without requiring an ultrasound.
Right. And, crucially, they provide the physical grip the doctor uses to remove the device when its lifespan is over.
So the sources describe these strings as being made of a soft, flexible polyethylene plastic. And there's a really precise science to how they are handled during insertion.
Oh, absolutely. The clinical guidelines state they are specifically trimmed to about 3 to 4 centimeters from the cervix.
Wait, what happens if the doctor cuts them too short?
If they're under 3 centimeters, they become stiff and bristle-like.
Ouch. That sounds like it would cause a sharp, poking discomfort for a partner during intercourse.
It does, yeah. But if they are left too long, they can physically bother the patient or, coil uncomfortably.
So it requires a delicate spatial balance. Over time, those polyethylene strings will often soften due to body heat and moisture.
They do, curling up around the cervix. In fact, they remain a physical, artificial presence residing at the very top of the vaginal space.
They hang down into the vaginal canal almost like the pull tab on a parachute.
That's a great analogy. They're a passive safety mechanism meant to be left completely alone until it is time to deploy.
Or, in this case, remove the device. So if they are just sitting there passively, what happens when you introduce a medical wand specifically designed to blast heat into that exact same area?
Well, this raises an important question. To answer it, we have to recognize what those strings represent diagnostically.
You mean as proof of stability?
Yes. If a patient or a doctor cannot locate them, or if there is unexplainable pelvic pain or abnormal bleeding.
The physical assumption is that the IUD has shifted.
Right. It might have expelled entirely, or it might be actively perforating the muscular wall of the uterus.
Wow. So this baseline geography is critical because any vaginal energy treatment demands the underlying anatomy be completely stable and healthy.
You cannot introduce extreme energy to an area if a piece of rigid plastic might be currently migrating through the uterine wall and causing internal trauma.
Okay, so the geography has to be perfect, and the strings are the proof. Now we need to look at what these energy treatments are actually doing in that space.
Yeah, the term vaginal rejuvenation is plastered all over cosmetic clinic websites, but the physics behind it are intense.
Medically, we are dealing with energy-based devices. The main categories are carbon dioxide, or CO2, lasers, erbium lasers, and radiofrequency, or RF devices.
You will see them marketed globally under brand names like Femilift, Mona Lisa Touch, Thermiva, or EMFEM 360.
Reading through the clinical mechanisms, the actual process is staggering. Let's break down the difference, starting with the lasers.
CO2 lasers work by vaporizing water inside the superficial cells of the vaginal wall, creating microscopic columns of damage.
Meanwhile, radiofrequency waves penetrate deeper into the submucosal layer, generating bulk heat without breaking the surface.
But in both cases, the goal is delivering highly controlled thermal energy directly to the tissue.
And the temperatures inside the vaginal canal during these treatments can reach between 45 to 60 degrees Celsius.
Which is hot enough to denature proteins. You're fundamentally altering the cellular structure of the tissue.
Wait, 60 degrees Celsius is the temperature we use to pasteurize milk? The goal is to intentionally injure the tissue with extreme heat.
It sounds incredibly counterintuitive, I know.
Yeah.
Especially if a patient is seeking treatment because they are already experiencing discomfort.
Like the dryness or thinning tissues associated with menopause or postpartum changes.
Right, it seems paradoxical, but it relies entirely on the body's natural wound healing cascade.
So by creating these micro-injuries or inducing thermal stress, the device forces the body to go into repair mode.
Exactly. Fibroblasts, which are the cells that synthesize the structural framework of human tissues, rush to the area.
Oh, and the body starts producing fresh collagen and elastin to heal the perceived damage.
So the theory is that the body replaces the thinning, inelastic tissue with new, highly vascularized tissue.
Meaning tissue packed with fresh, healthy blood vessels.
Yes. And the goal is also to create glycogen-rich tissue. Glycogen is a complex sugar that fuels the lactobacilli.
The good bacteria in the vaginal microbiome.
Exactly, helping to maintain a healthy acidic pH. So the thermal injury is simply the catalyst for a biological renovation.
It's the exact same concept as microneedling or deep chemical peels for your face, but applied internally to a highly sensitive mucosal membrane.
Which brings us to a massive, critical caveat. In July 2018, the FDA issued a severe safety communication regarding these exact devices.
They didn't just issue a mild warning either, they actively rebuked the aesthetic industry.
The FDA explicitly stated that these energy-based devices are not approved for the umbrella marketing term of vaginal rejuvenation.
The lasers are legally approved for very specific destructive surgical uses like ablating precancerous cervical tissue or removing genital warts.
But they have not undergone the rigorous, long-term, sham-controlled trials required to prove they safely treat the complex symptoms of menopause.
Or urinary incontinence or sexual dysfunction.
The agency received a disturbing influx of reports linking these thermal treatments to serious adverse events.
We are talking about severe vaginal burns, deep scarring, long-term numbness, and chronic recurring pelvic pain.
The margin of error is razor thin when you are heating delicate tissue to 60 degrees Celsius.
So we have devices intentionally bringing human tissue to a pasteurization temperature, carrying a known FDA-reported risk of severe burns.
And we have patients walking into clinics to get this done who also happen to have an IUD complete with polyethylene strings sitting right in the line of fire.
Let's look at the actual collision. What happens when that intense energy meets the contraceptive device?
The clinical guidelines make one thing abundantly clear. The material of your IUD is the ultimate deciding factor.
So having an intra-uterine device doesn't automatically disqualify you from laser or RF treatments?
No, but if you have a copper IUD using brands like Paragard or Mudela, the physics of the situation change entirely.
Because copper is a highly conductive metal. The sources state unequivocally that radiofrequency treatments are strictly contraindicated for patients with a copper IUD.
Radiofrequency waves and electromagnetic energy interact aggressively with metal.
So when you apply RF energy to the vaginal canal, it induces an electrical current.
And that current can travel up the canal and cause the copper wire wrapped around the plastic frame of the IUD inside the uterus to heat up rapidly.
Through a process called ohmic heating.
Yes, we are back to the aluminum foil in the microwave.
It's not just about the plastic strings getting in the way. It's about the electromagnetic field turning the contraceptive device inside the uterus into an active heating element.
That microwave analogy illustrates the danger perfectly. The copper absorbs the electromagnetic energy, which could lead to severe internal cramping.
Or worse, actual thermal burns deep within the uterine cavity.
Yeah.
You would be heating the uterus from the inside out.
And it isn't just the thermal wands causing issues with copper either. We also looked at treatments like Emcella.
Right, this one doesn't use a wand inside the vagina at all. It's an aesthetic chair you sit on fully clothed.
Uses high-intensity focused electromagnetic technology, or IFEM.
IFEM works by generating intense magnetic fields that penetrate the pelvic floor, right?
Yes, these fields induce electrical currents in the motor neurons, bypassing the brain entirely to force the muscles to contract.
The literature says it essentially forces 30,000 supramaximal Kegel contractions in just 30 minutes to treat urinary incontinence and strengthen the pelvic floor.
And Emsella strictly forbids patients with copper IUDs from using the chair. The massive electromagnetic fields heavily interfere with the metal.
But beyond the electromagnetic risk, there's a mechanical risk too.
Oh, absolutely. Some clinics note that therapies utilizing intense pelvic floor vibration, like EMS training or power plate therapy, carry an increased risk of expelling the copper IUD entirely.
Because you are subjecting the pelvic basin to thousands of violent mechanical shakes or contractions, physically jarring the heavy copper device loose from the uterine wall.
Exactly. The mechanical stress alone is a contraindication.
Well, if copper is the main villain because it conducts heat and reacts to magnetic fields, then logic tells me a completely plastic hormonal IUD like a Mirena, Skyla, or Kyleena is perfectly safe.
You'd think so. There's no metal to spark, and plastic doesn't conduct radio frequency waves.
But a plastic hormonal IUD introduces a totally different diagnostic danger.
What's fascinating here is that the polyethylene plastic of the IUD and its strings actually has a melting point much higher than 60 degrees Celsius.
So the primary danger isn't that a CO2 laser is going to melt your strings into a puddle? Then what makes the plastic IUD a risk factor?
The danger circles back to our initial geography lesson. The strings are a vital diagnostic tool.
Ah, right. Before a clinician even touches a laser wand or an RF device, they must perform a physical examination to visualize and check the tension of those strings.
If a patient comes in seeking vaginal tightening because they feel a sensation of looseness or pelvic heaviness,
And the clinician simply assumes it's age-related laxity without checking for strings. They are walking into a trap.
because that feeling of pelvic heaviness might actually be an expelled IUD sitting in the lower vaginal canal.
Or the strings might be missing because the device has migrated up into the abdomen.
That's the core issue. You cannot safely apply 60-degree thermal lasers to a vaginal canal if an IUD is actively displaced, perforating tissue, or causing an occult, meaning hidden underlying complication.
If a provider skips the string check, they are applying severe thermal stress to an area that is already anatomically compromised.
Which leads directly into a wildly frustrating gray area for anyone trying to research this as a consumer.
Yeah, as we combed through the guidelines from different clinics globally, the medical advice was not unified at all.
The protocols vary drastically depending on the clinic's underlying philosophy.
For example, we found guidelines from Dr. Ezer Das's practice, a prominent aesthetic clinic, stating very broadly in their FAQ that RF can be done in IUD users.
Right, they say there is no need to remove the IUD before the procedure. It sounds like a total green light. Walk in, get the radio frequency, walk out.
But then you read the clinical pathways from the Women's Health Clinic, which operates under a strict safety-first medical model.
Their guidelines say having an IUD doesn't automatically rule out a laser, but a blanket answer of yes or no is dangerous.
The clinician must document the exact device type, map the position of the strings, and review the patient's entire symptom history before proceeding.
If we connect this to the bigger picture, this discrepancy highlights the profound tension between the rapidly moving cosmetic industry and the traditional, cautious medical establishment.
The cosmetic approach often treats the body as a canvas for aesthetic enhancement, prioritizing efficiency and patient turnover.
While the medical approach views the body as a complex, interconnected system where altering one variable can trigger an avalanche of complications.
It's infuriating for the listener. I mean, if you read one clinic's website that says, no problem, come on in, your IUD is fine.
And another that says, wait, we need to map your anatomy, verify your strings, and rule out complications first. Who do you trust?
You must unconditionally trust the provider who asks about the strings and the specific type of IUD.
The Women's Health Clinic guidelines make a phenomenal point. Laser or RF treatments cannot and should not replace a proper medical pelvic floor assessment.
Delaying an aesthetic treatment to physically check an IUD's status is a protective measure against the exact severe complications the FDA warned about.
A displaced IUD isn't just a mechanical problem, it's a biological one.
If the plastic migrates or irritates the tissue, it can trigger an active pelvic infection. And the FDA guidelines heavily stress that these energy devices should never be used if there is any active infection present.
IUDs, while statistically very safe, can occasionally be associated with specific bacterial issues.
like recurrent pelvic inflammatory disease or the presence of actinomycosis?
Actinomycosis is an anaerobic bacterium that can thrive on foreign bodies, like an IUD, over many years.
It creates low-grade chronic pelvic inflammation and sometimes microscopic abscesses in the tissue.
So if a patient has actinomycosis, the localized tissue is already inflamed, swollen, and biologically compromised.
Applying microscopic thermal injuries to tissue that is actively fighting a deep bacterial infection is a catastrophic contraindication.
It throws gasoline on biological fire. The 60-degree heat will exacerbate the inflammation, overwhelm the local immune response, and lead directly to the severe chronic pain and deep scarring the FDA flagged.
So, bringing all these threads together, what does this mean for you, the listener, navigating this medical landscape?
Yes, IUD strings and the devices attached to them absolutely can interfere with vaginal energy treatments.
The nature of that interference is dictated entirely by the elemental makeup of your device and the diagnostic diligence of your provider.
If you have a copper IUD, the physics are clear and undeniable.
The electromagnetic heat from radiofrequency and the intense magnetic fields from high-fem chairs make these treatments highly dangerous.
You risk internal ohmic heating and severe mechanical expulsion.
But if you have a plastic hormonal IUD, you avoid the metal conductivity issue. However, your strings become a mandatory safety checklist.
Those strings must be physically visualized and verified by your provider to ensure the device is perfectly seated in the uterus before a single pulse of laser or radio frequency energy is applied to your vaginal walls.
This requires you to be a fiercely proactive advocate for your own anatomy. Never assume a cosmetic clinic has culled your full gynecological history.
You must verbalize exactly what type of IUD you have. You must insist the provider performs a physical exam to check your strings prior to turning on any machine.
And if you are experiencing unexplained pelvic pain, abnormal bleeding, or if you simply cannot locate your strings during a self-check.
You need a diagnostic ultrasound from an OB/GYN, not a cosmetic laser.
It's about respecting the sheer complexity of your own internal anatomy. You can't just stack treatments without understanding the physics. Which leaves us with a really profound thought to chew on as we wrap up.
As medical technology advances at this breakneck pace, we are increasingly treating the human body like an upgradable machine.
We insert slow-release hormonal devices into the uterus to control our fertility for a decade.
We beam highly calibrated thermal lasers into our mucosal tissues to rewind the clock on aging and childbirth.
We sit on focused electromagnetic chairs to bypass our brains and force our muscles to contract 30,000 times in half an hour.
We are stacking biological hacks on top of structural hacks.
We are. But consider what happens decades from now.
The average person might have 3, 4, or 5 different advanced biotechnologies overlapping in the exact same geographic area of the body.
Will our current siloed medical safety checklists be robust enough to handle the complex biohacking of the future?
Or will the intersection of these overlapping upgrades create entirely new cascading medical complications we haven't even begun to predict?
It's a wild thought, because right now, when you step into a clinic, you want the simple, clean binary of an X-ray.
You want the precision of straightforward engineering.
But as we've learned today, when you mix the daily reality of an intrauterine device with the intense thermal physics of a rejuvenation laser, that diagnostic landscape is anything but clean.
It demands an entirely new level of anatomical awareness.
And navigating that awareness means knowing exactly what's inside you and how it reacts to physics before you let anyone turn up the heat.